Thanks for joining us for this symposium. I'm Bill Rapisi, President and CEO of the Lymphatic Education Research Network. LE&RN's mission is to fight lymphatic diseases through education, research, and advocacy. In order to win a fight, you first have to join it. So we ask, please become a supporting member of LE&RN at lymphaticnetwork.org. And we hope you enjoy today's symposium.
Thank you, everybody, for being here. This is part of a series that we are just really grateful to have the opportunity to do with LE&RN, the Radical Embodiment Living Well with Lipedema series. And this is the third in a series that we're doing that will last through the year, once a month until the end of the year. And this particular presentation is about those physical management strategies that you can do for lipedema. And we're hoping that we're going to be able to provide you with maybe some new strategies you haven't considered and that you would like to explore, maybe something that can benefit you. So I'm pleased to be here with my co-presenter, Adi, and we'll do a little bit more about our information about us in a second here. Go ahead and go to the next slide, Adi. So, and this is made possible, of course, by all these wonderful sponsors. So we really appreciate that all these organizations are involved in supporting LE&RN to be able to provide all of these symposium series. And I saw a post go in the chat just as a reminder to everybody that we will take question and discussion at the end of our presentation. But until then, go ahead and use that Q&A button that you see at the bottom of your screen and post your questions there. You can post other comments and things that you just want to share in the chat. Feel free to go there. But if you have a question that you would like us to speak to, make sure you put it in the Q&A box. And then this is just an important disclaimer that although Adi and I are healthcare providers, this is not meant to be medical advice directly to you and your situation, just information for you to then discuss with your healthcare provider. And a couple of disclosures. I am an instructor for Klose Training and Consulting, and Adi is a consultant for Eros Medical. I'm an occupational therapist and certified lymphedema therapist. I have my doctorate in occupational therapy and been treating lymphatic and fat disorders for over 20 years. And I am associated with the Lipedema Project. I am the president of the board and director of research for the Lipedema Project. And through Lipedema Project, Lipedema Simplified, that's how I know Adi. And so Adi, just tell us a little bit about yourself.
I am a certified lymphedema therapist and have been for about 12 years at this point. I'm a breast cancer survivor with upper extremity lymphedema, so I have some personal understanding of what we're dealing with lymphatic dysfunction. I'm a massage therapist and I work at the Osher Center for Integrative Medicine at Vanderbilt, which allows me to work with lots of patients with chronic pain and chronic conditions, which brought a lot of lipedema patients to my table and really helped amp up my knowledge of that part of the CLT treatment concerns. And I am a certified, national board certified health and wellness coach, and I do some coaching with Lipedema Simplified.
Yeah, thank you, Adi. So what are we going to talk about today? So just a quick definition of lipedema, just to make sure we're all on the same page in the condition that we're talking about today, managing with these physical management strategies. And then one of the really severe symptoms of lipedema is pain. So we're going to take just a moment to talk about pain issues. And then that is one of the things you might be managing with your physical management strategy. So we're going to talk about not only complete decongestive therapy and the components of that, pretty much the gold standard for treating lymphatic and fat disorders, but then we're also going to talk about all those many complementary treatments that can be used as in addition to CDT. And then some resources for you, where you can find help, where you can get more information about all these strategies. So very quickly about what is lipedema. And I have pictured here a very common depiction of lipedema, but of course there is a huge variance on how you look when you have lipedema. But typically we have that disproportionate fat deposition on the lower body. So you really see that she is much larger on the lower body than she is in her trunk. But there is some effect in her arms. So, and it can happen in the arms, particularly the upper arms, but it can extend all the way to the wrist. And very, very common is that women will say that it happens during those periods of their life where their hormones are changing. So puberty, pregnancy, and menopause. And there is evidence of non-pitting edema. So you can see a volume or a size change just over the course of a day. Typically, it's going to be worse in the evening. Some very important recent studies of showing that there is evidence of edema in lipedema, and hypersensitivity and pain, which we're going to talk about more. But this is, much more severe pain to those lipedema areas that other people do not experience that same kind of response. And easy bruises just showing up in the lipedema areas of your body, and you have no idea how they got there. And tissue changes. And this picture, you can see that her skin actually is quite smooth, but often we will see that mattress-like corrugated kind of dimpling of the skin. And as you see that the skin and the tissue changes, you can feel nodules, grainy nodules, or even larger marble size nodules under the skin. And then you can get that cuffing appearance because the fat abruptly stops at the ankles. And if it extends on the arm, you can also see a wrist cuff. And then the most common to this person who has lipedema is that limited or no response to the lipedema areas of their body, typically the lower body, to typical weight loss measures with low calorie, low fat dieting. So these are common denominators with lipedema. And so just briefly about pain and what we're learning about what might be the cause of lipedema pain. So what we're seeing first is that we have women with lipedema, we're going to have those repeated exposure to these external stressors. And so these stressors that can cause inflammation are,
come on.
there it goes. And a top concern is inflammatory foods, because that's something you're repeatedly putting into your body on a daily basis. And so particular foods can cause that stressor and increase inflammation. And then there could be estrogen dysregulation. It seems to be fairly common in women with lipedema that the sex hormones are not behaving appropriately, maybe problems with estrogen receptors. And so there is some dysregulation with the hormones. And tissue hypoxia, meaning you're not getting enough oxygen to those cells, that is also going to create an inflammatory situation. And then excess toxin and waste products. And then as our lymphatic system becomes overwhelmed with an increased lymphatic load, it's not removing those waste products adequately. They're staying in the tissues and can be also causing that repeated exposure to stress. And so all of these stressors are combining to then create this chronic and low-grade inflammation. And then we do believe that that is also, it can at least contribute significantly to pain. So what can we do to manage the pain? And we're going to be talking about some physical management strategies for that symptom as well as other symptoms of lipedema. And a lot of this information came from a wonderful article by Dr. Alexandre Amato, a surgeon in Brazil. And he talks about identifying what are the triggers for that particular person. What seems to be their stressors that's elevating the inflammation. And so then what can we do to modulate our exposure to whatever those particular triggers are? And it really involves a comprehensive program. So it's not any one thing that is going to help, We need to have a variety of things to work in concert. And it really has to be individualized, because what is going to work for one woman may not work so well for another. So let's talk a little bit about that gold standard, complete decongestive therapy. Many of you are familiar with this traditional treatment for lymphedema, and as it can be applied also to lipedema. And so it has these basic 4 components. You're going to have manual lymph drainage, a specialized massage technique that we'll be talking about some more, specific skin care, compression therapy in a variety of different ways, and some sort of movement and physical activity. But I would say one of the overriding things is patient education. So because you are only with your trained healthcare provider for a limited amount of time, the rest of the time you're managing all these things on your own in order to have your best quality of life. And so the patient has to know, and their caregivers, their friends, their family have to know, how are they going to move forward to be able to manage this chronic condition.
So we just talked about what CDT is, and the manual component, the massage-like component, is manual lymph drainage. And if you have lymphatic dysfunction, you have probably experienced this. I hope you have. And that is this gentle pressure and skin stretch that helps promote the absorption of that fluid that's hanging out between the cells. And it reduces edema by increasing that contraction of the lymph vessels and helping in cases where there are missing pathways due to some kind of trauma or surgery or other intervention, helps to form new ones. In that, it can reduce pain by removing the things that need to get out of our system back to the lymph system so they can be processed out. And that there's a very soothing feeling to this type of body work. And it promotes a deep relaxation, parasympathetic type response in the nervous system. But there are many other types of manual therapies or massage therapies that are beneficial to people with lymphatic dysfunction. And lipedema patients tell me that Swedish massage is very helpful to them. It can be energizing or relaxing. And in Swedish massage, we tend to use lotion or oil and slide on the skin. There's other strokes as well. In deep tissue massage may be similar to Swedish massage. That's a bit of a general term. So it might be myofascial release. It might be deep, slow, firm pressure to get into the muscles that are below the surface and to get into the connective tissues. Myofascial release focuses on the connective tissue and can help to remodel scar tissue. It can help to release areas that are chronically bound down and impeding the flow of our fluids. So that there's a variety of ways in which myofascial release can be helpful. And the image there of the fascia itself is pretty interesting, what it looks like on a microscopic level. And then also in the not traditional CDT manual therapies, we have the cupping techniques. And cupping is a real ancient form of alternative medicine, and it may have come out of traditional Chinese medicine or other Asian traditions. And it can itself perform some myofascial release. It can there's a lot of theories about how it works, but it decompresses tissues, and that can be helpful with pain, inflammation, circulation, and that itself can be relaxing. People with lymphatic dysfunction, I think, should avoid the very aggressive cupping techniques because there are some that are intending to leave bruising. And if we've already got difficulty reabsorbing fluids, we might not want to intentionally bruise ourselves. And then we do have mechanical cupping options, which are very helpful and very controllable. Kinesio tape is something that we can learn to use to lift our skin and create improved drainage in a specific area. We can also use it to address joint issues. So this very healthy looking model here is trying to do some abdominal drainage with the tape, and then also to support a shoulder joint. So the tape is interesting. Oh, I'm sorry, what did I just do? Let's go back here. The tape is really interesting in how it can be used in a variety of ways. But some people have strong allergies to adhesives. So it's good to patch test and make sure that an individual is going to tolerate this tape. So I'm going to turn this over.
Okay, so we'll talk a little bit about skincare because it becomes very vital to manage the health of your skin and your tissues when you have lipedema. And I saw one person post that they also have lymphedema. And so just when your tissues are not perhaps getting enough oxygen, as we see in lipedema, or there is any fibrosis present, or not removing waste products as much as should, then we are vulnerable to infection. And so we really want to practice really good skincare. And so one is washing, sometimes really daily washing, particularly in between skin folds. That has a propensity for developing infection, getting in between those, any creases between the toes, keeping them clean, and also dry. And that moisture, lingering moisture, can be a fertile ground for any fungal and other types of infection. So, and then we're going to use a low pH, preferably moisturizer, because now if we're below 7 pH, it's going to be more acidic. Acidic is not a favorable environment for bacteria. And so everybody has bacteria always living on their skin. And so if we can make it not so favorable by using an acidic lotion, most of them are, and you're just looking for that pH that's below 7 if you can with your lotion. And then if you do get a fungal infection, a really nice home remedy is just a 50-50 vinegar and water solution that you can apply to the area that has fungal infection. And then inspecting your skin daily, looking for is there any macerated or split skin, open areas, and we want to treat those and monitor them carefully, because again, lipedema is less of a risk for infection than lymphedema, but careful when you have both of these conditions together. You really want to monitor and care for your skin carefully.
So
I'm going to hand that to you, yes, because
I thought so.
80 is the compression queen.
Oh, I don't know that, but I do love compression, and I love all of the different types. So the multi-layer compression bandaging that we do, especially if lymphedema is present, is so effective. It's just a blessing to be able to get fluid out of the tissues as fast as that approach can. Compression garments can help prevent re-swelling, or in the case of lipedema, they can simply be supportive and help to move fluid out of the tissues. And that can be very relieving of discomfort and give a sense of support. The pneumatic pump is a great tool to be able to allow yourself to experience a home manual lymphatic drainage type session that is very useful on demand. So the benefits, as I mentioned, it can prevent reaccumulation of fluid and break up and soften fibrotic tissues, which is very important for the health of the skin. It will increase the pumping action as it resists against muscles pumping and becoming more compressed. And the tissues are massaged, contained, or supported. And again, this is helpful for pain and for just sense of well-being. There are a variety of garment options when we're talking about that type of compression. And some of them are more intended for daytime, and some of them are more intended to sleep in. With daytime options, we have stockings, leggings, capris. I love if a person needs the full leg and abdomen to be supported in many cases to break the garments up and use lower leg stockings and capris on the upper part, but there are multiple ways to do that. Sleeves for the arms, abdominal bands, circular knit fabrics are often available in standard off-the-shelf sizes, but can also be made custom. Flat knit type garments, which I believe this model is wearing, are usually cut and sewn from a particular type of fabric that is designed for this use. And then massaging types, and I don't know if you can see that the abdominal band has this texture, but you can certainly see on this stocking that there's a texture that will imprint into the skin. And as the person wearing them is moving around, it's kind of massaging and helping to move that fluid back into the central system. But you don't have to necessarily, depending on your presentation, invest in compression garments. Some patients very successfully use yoga pants, athletic tops, and it's simply important to make sure that things are applied smoothly and that there's no place that they're digging in and creating kind of a tourniquet. So nighttime options, or lounging options, as some of the manufacturers call them, can include things that are made with Velcro attachments, so they can be snugged up over time. And they are generally styled in a way that makes them safe to sleep in. So these can be used, something like is shown here can be used to help with reduction as a potential substitute for multi-layer compression bandaging, although that is the gold standard. But they also can be beneficial for sleeping or for daily wear because they can be remolded to your presentation of the individual day. The quilted garment shown here is a custom garment, and there are some of those that are also available with Velcro, but this one happens to be made to measure for this patient. The one shown here is made of a neoprene-like material, and as you can see, it can be molded to a unique presentation of body part. And these, again, are going to help with the reduction of the edema or lymphedema. And some have innovative cooling fabrics, like this one here is made with a fabric that is intended to stay cool. And we hear a lot of complaints at this time of year from people wanting to use compression, but being too constrained by heat with that. The pneumatic pump is something I'm extremely enthusiastic about. And when I was a CLT student, I was told that pumps are bad and that we shouldn't use them. And I think the concern was that we don't feel with our hands what's going on in the tissues if we've got someone in a pump. So I don't think that they are in an ideal situation, I don't think that they're a substitute for manual lymphatic drainage, but we don't all have ideal situations. And so these pumps, which can address a variety of body parts, have the ability to reduce a tendency toward fibrosis, to increase the lymphatic uptake, and to provide kind of a massage on demand, which many people find very soothing and enhance their quality of life. I really love that a person can just choose to do this on a daily basis or can use them as needed.
Yes, and now we're going to talk about another component of CDT, which is some kind of movement and physical activity. And what I've found for my patients who maybe are have impairments to their mobility and feel like they can't exercise, or for whatever reason, that to kind of reframe how we think about exercise, because playing with your grandchild, as this woman is movement, and but we don't call it working out. it's just it's playing with your grandkids, or it's dancing with your friends, even if you're dancing by sitting in a chair. So kind of reframe what you think of as movement and exercise, and think of those pleasant activities that you do enjoy that involve moving your body in some way, and then hopefully finding some pleasure in that movement. And so you can actually reap those benefits of what we like to call exercise, but you're still enjoying yourself. So trying to find each day, how are you going to move? And so it really is important to try to move every day. So many of us are glued at our computers for these webinars and doing lots of stuff online. And so making sure that we move some way, and we're not just sitting for hours and hours at the computer. So in even short increments, just a few minutes, less than 10 minutes, but doing them often throughout the day is going to make a huge, have a huge effect. Adi likes to call this dosing your exercise. So it doesn't have to be, an hour complete that you have to do that exercise plan. It can be dosed throughout the day. So we really want to work on building, if we can, but at least maintaining your muscle mass as you age, keeps you from falling, gives you, it just makes you feel better. So we want to keep that muscle mass that we have, and hopefully even add to it.
So we've talked about the general concept of exercise, and we're going to go into a few of the options with exercise here. And again, the dosing concept: start slow, take it in small bites. Make sure you're working at your own fitness level. I think the thing that I've seen the most in lymphatic therapy for people who have been at risk of lymphedema for long periods of time and then suddenly develop it is that they tried to do something that was outside their capacity and they pushed themselves too hard. But the exercise is going to improve your circulation of body fluids, including blood and lymphatic fluid. It's going to release endorphins, so it helps by giving yourself some good brain chemistry, and reduce inflammation, improve mood, and can definitely help with sleep quality. What I love for people who are suffering with a lot of pain, especially if it's joint pain and just feeling that weight of the fluid in our tissues, is to get into the water. And fortunately, at this time of year, that sounds pretty good. The water itself is going to provide compression on your whole body, more at the lower part. So I don't love to ask people to swim. I really like people to just stand in the water, deep water, and move their bodies, do your little ballet exercises. That water is going to give you the compression. It's also going to provide resistance. So as you're moving, the faster you move, the more resistance you're going to encounter. Again, at your own fitness level, your joints will be supported. Much of gravity is eliminated when we are in that aquatic environment. It itself will encourage you to breathe deeper, and that deep breathing is so important for massaging the thoracic duct, moving our lymphatic fluid back where it belongs. And that can be very safe for those of us who do have joint issues or are weak and just getting back to activity. It's not going to be so dangerous if you fall in the water. Exercise on land. You can be walking, and you can do that on a treadmill. or you can do that outside. And again, taking short periods of time to walk can be very beneficial and get those muscles and joints moving to encourage the right fluids to be in good shape within those joints. And again, encourage deep breathing. I personally love Tai Chi, Qigong, and yoga, sort of ancient exercise traditions. And these can be done following internet programs and learning just a few moves and enjoying those. They are very focused on specific breathing techniques, so that's helpful with the breathing as well. But again, stay within your fitness level. Yoga can be strenuous. Martial arts can be very strenuous. But then you can take any of these into the chair. So if you are not fit for being on your feet, if you're dealing with joint issues, sometimes just getting your body moving in the chair is a really fantastic way to elevate your mood, calm your system, and get the fluids moving the way you want them to. All right.
So, and that now we come to that most important part, I think, when we're bringing all this together, is that patient education program. So we need to, it has to be a comprehensive program. So it can't be just getting the manual lymph drainage. It can't be just putting on a compression garment. It has to be a full program. It has to be individualized to you. And then you have to learn, how am I going to be managing this on my own? Am I going to do self MLD? How am I going to get these garments on and off? How do I get the hard to reach areas on my skin in order to care for that? All these things have to be learned, hopefully with the guidance of your trained therapist. So, and then I think most important for lipedema is to identify those triggers that are potentially causing you inflammation and pain. So this is something that you can work with your trained healthcare provider on, and to try to distinguish what might be those things and how can you avoid them? How would it be? How can you have your chosen lifestyle, but not have so much exposure to those harmful triggers?
So some other things that we can do are incorporate vibration, which is purported to be very helpful for a variety of body functions. There is some evidence that it can help with bone building, which is always like keeping our muscle mass, keeping our bone mass. That's going to help us motivate through the world much better. Even these small machines that are fairly inexpensive on Amazon are very useful, and I'm sure there's other platforms selling them. And then these big machines are more for the whole body. There's a variety of price ranges for these items, but they all have the ability to modulate the level of vibration. And as with anything else, you want to start slow and short doses and notice your response. The mini trampoline can be a great thing, an inexpensive item to have at home, and just bouncing on it, dancing on it, doing heel drops on it. All of these things can be very useful. Most importantly, though, we never want to fall. So making sure that, again, you're within your fitness level, you have the adequate balance, and it's not a bad idea to put it in a corner and be able to grab walls or buy one of the ones that has a grab bar attached to it. Other things that can be delightful. I am a huge fan of Epsom salts baths, and I always notice that I have lost any puffiness afterwards. So I guess the osmotic action of the minerals in the water really helps to pull fluids out of our tissues. And I really believe that even though a warm bath, there's the possibility that it could increase some fluid in the tissues, it seems that the deep breathing that it encourages and the relaxation it encourages has the propensity to help the uptake. But it's important to know your own response. Dry needling and acupuncture, of course, use needles, but they have great support in literature showing that they can help reduce pain and improve a variety of kinds of functions. Dry needling more for trigger points and really deep muscle problems. Acupuncture functions more on a belief in a body system that's really different than what we're taught in Western medicine and Western culture. But boy, that can be fabulously effective. Meditation is probably something we all should do in a stressful world, and can be just a few moments of focusing on your breathing. But there's many meditation techniques out there to learn, and many different breathing exercises that one can engage in. Sometimes they are, these breathing exercises are counted. Sometimes it's alternate nostril breathing. And I didn't realize we had all these wonderful pictures here. But sometimes just providing a little resistance on your own with your hands as your abdomen expands, and then following the exhalation as the abdomen comes back inward, that can help increase the uptake of fluid in our central system. So I definitely encourage learning breathing exercises. Dry brushing can help to exfoliate any dead surface skin. I think with dry brushing, I've noticed that it's important to have a brush that will give you a very gentle skin stretch without damaging your skin. So if your skin is really swollen, if you've got lymphedema, make sure those bristles aren't going to tear your skin, because then you're going to be at more risk for infection. But if you are using the right brush, and I've had patients just use a washcloth that's dry to do this. But if you're stroking back toward the trunk, back toward your heart is a nice way to think of it as well. We can encourage the uptake of fluid and improve the health of the skin, and again, have some calming action. So when you're trying to decide what to experiment with, things that you need to consider are who and what is available in your area. Ideally, I think anyone managing a lymphatic dysfunction should have a CLT. If you possibly can engage with a certified lymphedema therapist in a medical setting so you can initially take advantage of your medical benefits, that's great. That's ideal. Not all of us have access to that person, and many massage therapists are trained in manual lymphatic drainage, and some of us massage therapists are even certified lymphedema therapists. And so it may be that that's who you find in your area. You may benefit from a pneumatic compression pump that would allow you to experience MLD on demand at home. And you will need a prescription to obtain something like this. It would be better to do that than just buy something that's being sold used, because it might not be appropriate for you. So having some guidance in choosing a pump would be important, and having your CLT or your medical provider help you with that. When you're choosing that CLT or medical provider or massage therapist, who are you going to trust? Who has been recommended by people you trust? So you might need to ask a lot of questions when you're interviewing someone to work with, and get information about their training, their years of experience, their focus. But it also can be really helpful to get recommendations from those trusted mentors and supporters. And then think about what conditions you're trying to address. Is it pain? Is it muscle tension? Is it edema? Is it stress? Is all these things that may help you determine who is going to be a good person and what activities are going to be most beneficial to you. And then always we have to think about our budget, and that includes financially and time-wise. So these are considerations we need to have. And I I think that any certified lymphedema therapist is going to teach you to do self-treatment. That is part of this comprehensive plan we've been discussing. So it is really important for all of us to know how to do self-MLD for sure, and then self-MFR, myofascial release, can be done using tools. It can be done simply with stretching. So learning to do these things can be very helpful to address problems that arise.
So here's some really important resources for you. And I did not include links, but I will tell you that if you want to find a trained clinician certified in lymphedema therapy, and lymphedema therapists often also are very versed in treating lipedema, then here is some good places to go to. And first is the LE&RN website. I think it's Lymphatic
Education and Resource Network?
Yes, it's a Lymphatic Education Resource Network, but I was trying to think of the website, which I'm sure that Steve can post in the chat for you. But when you go to the LE&RN website, then you are going to, you can get directed towards a page that will give you links to all of the lymphedema therapy training programs. And so when you follow those links, you can see all the graduates of those training programs. So now you know everybody who's listed there is certified in lymphedema therapy. Then from that, you can usually you put in your zip code, and then you can find someone in your, hopefully within a not too far radius. Thank you very much. This has been posted there, lymphaticnetwork.org. And then that also giving you a link straight to that page to find a lymphedema therapist. And so the issue is that not all training programs have a big focus on lipedema. So even though you find a certified therapist in your area, it still behooves you to call the clinic and see what their training and information is on lipedema, what their experience is, what kind of things they do for lipedema. And if you're particularly looking for, well, I want to have myofascial release, I'd like to try that. Does someone at the clinic, are they trained, and can they perform myofascial release? So if you want to experiment with vibration, do they maybe have a vibration plate at their clinic? So all these things you can discuss and try to find the clinic that might be a good fit for you. The Lymphology Association of North America, LANA, is also a good place to find certified therapists. And then the National Lymphedema Network, NLN, they also have a function to help you find therapists. So I would say those are the three big websites to go to try to find someone who's near you that has the experience in the training. There's also a lot of opportunities for virtual support, particularly now that, you know, people have been more, you know, confined to home a lot. There's just a lot more happening online, and you don't have to go to a physical location always to get that support. And so two opportunities I listed here are the Lipedema Roundtable. That's put on by Lymphopress, and it is just once a month, and they get together and they discuss and provide support to each other. And then our Facebook group that we have, Lipedema, spelled the European way and also the North American way, Simplified Support Facebook group. If you're on Facebook, this is a great place to post your questions or just get support from your peers. And then a couple of websites that I would suggest is Lipedema Simplified and the Lipedema Project. Have a lot of information on there, as well as a lot of activities and educational opportunities. I would also like to suggest, and I'll put this link in the chat for everybody. We had a free webinar earlier this week, and talked about a lot of the similar information, but some other information that we didn't talk about today, particularly about that foundation through having a positive mindset and developing a wellness vision. So if you would like to watch that free replay, I'm just going to put it right here in the chat. Here we go, that you can go to that to watch that replay. And then, of course, and I can also post these emails in the chat as well. So this is our email to contact us if you would like to contact us, Leslyn at lipedemaproject.org and 80 at lipedema-simplified.org. Feel free to email us. Be thrilled to have you contact us. So thank you so much for this opportunity to present. And at this point, I'd like to go ahead and go to questions. And 80, I'm going to say that go ahead and just stop sharing, so we don't have to just watch that slide.
Okay.
And then, and there's quite a few. I saw some things going in the chat, but also quite a few things got posted into the in the Q&A. So I'm going to just go through those, 80, and feel free as I read one, you know, okay, feel free to take it. Okay, so Eileen says she's newly diagnosed. I'm educating my primary care physician, just trying to figure out how to handle this. How is this, I think she says, how is this treated in other countries? So Eileen, I'm thinking that maybe either you travel a lot or you're not in the North America area, and maybe you're outside of where 80 and I live. Is that, I think that's what you're asking about. Do you have a response, 80?
You know, I think that CDT seems to be internationally accepted, but there's definitely a discrepancy between the consensus in North America on how to treat lipedema and the consensus of many of the European providers. So, you know, I do think that you're going to find that it depends on where you are, what you're going to find. I wish I had a better answer for that, but I also think, you know, there are other organizations that might have more international listings. And I don't know, Leslyn, do you know if the International Lymphedema Framework has therapist listings?
And that is definitely a good place to try. And also International Society of Lymphology, ISL. So that is also, but keep in mind too, that many of the lymphedema training programs, although they're based in the US, they offer courses throughout the world. And so they have graduates throughout the world. I would say that they're much more dense in the US. And so finding those graduates outside of the North America, you might have to look at some of the, like the training programs that looking at a UK training program or something, you know, based in another country. So you could look for whatever country you're going to Denmark. And so Denmark lymphedema training program. And then you might be able to get graduates from in that particular country.
Yeah.
And JC, or maybe it's pronounced Jackie, says, I have both lipedema and lymphedema. Any suggestions? I think we did talk about that, but 80, do you want to expand on that a little bit more?
I just, you know, I definitely encourage you to find a CLT to work with for that. Compression is going to be your friend. Body work is going to be your friend. You want to get that lymphedema under control as soon as possible, get it down to its most decongested level, and then maintain that with your garments and activities. All of the stuff we talked about is important for any of us, and especially when we're dealing with lymphatic conditions.
Yeah, and I would say also that lipedema and lymphedema are both inflammatory conditions. And so finding those inflammation triggers for you and trying to minimize those in your life is going to benefit both the lipedema and the lymphedema. Yeah. Katrina asks, does natural lanolin have a good pH? And so I earlier looked that up really quickly. And yes, Katrina, it is 5.5. And lanolin, it comes from sheep. That's where that oil comes from. and I think it is very, very good for you. I have a favorite story of a podiatrist that would refer patients to me. And he said that his great grandmother, who grew up in the Ozarks, it was her job to take care of the family sheep. And into her 90s, the skin on her hands was absolutely, it looked like it was on a 20-year-old woman, because she had daily application of this lanolin, or that sheep oil, onto her hands. So if you're using lanolin, I would say that's good.
I do understand that you can have a wool allergy, which would make lanolin problematic for you. So be alert to that.
Yes, absolutely. And Katrina also says, I have a lot of wounds on the back of my heels. And she has those columnar legs, where shoes with the low backs are rubbing. And so have we heard of this before? And skin sensitivity definitely there between the toes when I try to wear flip-flops. So yes, and so I'm thinking that yes, we're definitely getting those skin issues because of just that constant rubbing, and also probably moisture staying there and breaking down the skin. Adi, do you have any suggestions?
I just feel for individuals who have trouble finding good footwear, but cute shoes are not necessarily something that are going to be healthy for us. And I would really encourage finding footwear that is safe for you. And I'm not a huge fan of flip-flops, because in many cases they're an opportunity to slide off your shoe and maybe have joint damage, and then that between the toe rub. So I do think that a little better than the single toe flip-flops are they call yoga shoes or yoga sandals, and they go between each toe, and they're a little bit stable, but then you still have to pay attention to your skin quality.
Yeah, and I would suggest too, thinking about using, if you have no problem with adhesive, think about using moleskin on. It's just an adhesive pad basically that you could put on the back of your heel, or those areas that tend to get rubbing. But if you have a problem with adhesive, this will not work for you. But I'm just thinking of a way to pad those areas that tend to get irritated.
That's so brilliant. I hadn't thought about moleskin since my backpacking days.
That's right. And then Cheryl says, what level of daytime compression is ideal for lipedema? My understanding was light compression if there is no lymphedema present.
I mean, I think that makes sense depending on your presentation. So, you know, even without lymphedema being present, sometimes we really need a little more support. You might need a flat knit garment to really have everything feel supported and not have any folds or things moving around. So, but yeah, I think that in general, light compression is very reasonable with lipedema.
Yeah, and it might be that that's a place you have to start just because of your hypersensitivity and pain. And then if you find that there is issues that require stronger support, then you can move into that. But starting light and seeing how it helps you or doesn't help might be a good place to start.
Mm-hmm.
Eileen also says, have cooling garments ever been shown to help either MS type vests of lower body? Do lower body cooling garments exist? I have no pain and I'm active, but summer outside activity causes swelling. So she's looking for something cool to wear, you know, when it's so hot, and preferably on the lower body.
Well, there's this fabric called burr, and they're making sleeves out of it, but I don't think they have yet made lower extremity garments out of it. I think the cooling fabrics are something that have been being requested by patients as long as I ran a support group for a long time. And whenever we had a chance to talk to a manufacturer, that was what the patients requested. So I think that they're very new, these cooling fabrics. I don't think that there's a ton of them out there. So I find personally that the compression garments that I have that have some kind of silver or copper thread woven into them, some of those are the micro massage type fabrics, and I've had some other garments, although I can't really remember exactly which ones just right now, that have had those metal components that actually are a little cooler. I thought.
Yeah. It's tough, but particularly if you live in a place that is kind of warm year round, just warm and warmer is your two seasons. So that is a difficult, it's a challenge.
Yeah.
And then Francine says, how do you know where to place tape if you have stage 4, and I'm assuming you mean stage 4 lipedema with nodules? And that it's going to be finding out from your trained therapist who also has training in using those special, there's a variety of brands, but they're kind of like a sport tape type of taping technique. They need to have training in that. And then they can also show you how to do this yourself. But there is some books out there and stuff like that, but you need to go to a therapist who has that training. And even if they you're not someone that you're seeing for lipedema, they might, if they have the training in just using the taping method, typically it's going to be a physical therapist, but there are OTs out there that do it as well. Consider just getting guidance just on the taping, but also a good idea just to consult with your lymphedema therapist.
Yeah, and I would say that when you start playing with tape, you do have the possibility of peeling off some surface skin, which then is not only uncomfortable, but is an avenue for infection. So definitely be careful.
Mm-hmm. I'm trying to work my way through all of these questions, and we're winding down. We still have a couple more minutes. I really apologize if I don't get to your question. Feel free to email us, and we can address your question that way. Angela says, I have run the gamut of garments, but my legs are upside down champagne bottle shape and cannot find anything that stays up. Oh, yes. This is a challenge, Angela. Adi, I'd love to hear what you do for that shape of legs. And really what Angela's talking about is it's probably a very skinny ankle and then goes up to a very large calf and just below the knee. It's very large right there, and it doesn't want to stay up.
And I definitely think that layering garments for that is the thing to do. A capri is a great thing to try, and then knee-high stocking. And it's going to depend on your whole body size, which brands are going to be best for you. And once again, if there's the opportunity to work with a certified fitter or a lymphedema therapist who's experienced with garment options, that would be very helpful.
And Suzanne says the information given seems to be mostly for lymphedema, and actually this can be used for both, but we are really trying to address physical strategies for lipedema. What will be specific to lipedema? Since lipedema makes the body very sensitive, I think deep tissue would be too aggressive. And you're absolutely right, Suzanne, that starting with some of those more aggressive techniques may not be tolerated in the beginning, but you will find that manual lymph drainage will actually help you be able to tolerate the deeper techniques, particularly with your lipedema. If you have a lot of fibrosis in that fat tissue, we do want to progress to a deeper, more aggressive technique, but it would be to your specific tolerance. That's why we want to have that individual program, specifically for how you're experiencing the symptoms. But definitely what we've been talking today about are these physical management strategies that are going to be great for lipedema.
And I found it surprising when my lipedema patients started telling me that they really needed deeper, firmer touch. I assumed that they would all, this has been an educational process, but I kind of assumed that they would have hypersensitivity and require MLD. And some of them have done much better when they have gone past the MLD into deep touch. But we do have to address what can you tolerate. And that's, again, that concept I have of dosing, like start with something light and gentle. And if that is not adequate, then go for something firmer.
I'm going to just take one more question. And there's still quite a few here. I do apologize that we didn't have time to get to all of those. Let's talk about, can I do MLD on my stomach? Might you have time to show us how to do MLD on our legs? I do not know how to use this technique on my legs and thighs. Great question, Judy. And this webinar, we're not showing you how to do that. It is something you really need to go to your certified lymphedema therapist and have them show you what is going to be good for you specific. But Adi, can you talk about that, about MLD on your stomach?
Oh yeah, I mean, there's drainage pathways for the stomach, and there you have access to stimulating the deeper lymphatics there as well. So I have definitely treated people who have swelling in the abdomen. Sometimes it's the result of some kind of surgical intervention, and sometimes it's just the way they are. And MLD is very helpful to them. We're usually going to be thinking about the regional pathways. And since we don't have time to do training here today, learning about those from your CLT can be very helpful. But then your own specific drainage is going to be affected by your life history and your activities. And again, finding someone to train you to do that effectively for yourself. In the meantime, practicing deep breathing is going to help with the abdominal drainage.
Mm-hmm. Yeah. Thank you very much. And with that, we are going to close up. It's been wonderful being here. It's fantastic comments that you all have made. Really appreciate you being here. Thank you.
Indeed. Thank you so much. What an opportunity.